recording? Alright, so again, this is going to be for Foundations of Communication. I'm Daniel Stout, and I'm going to be doing my persuasive speech. Alright, so today I'm going to talk to you guys about vaccinations. Alright, the first couple slides I'm going to show you are honestly not the prettiest to look at, but I'm using them, in fact, to drive the point home and how importantly I feel vaccinations are. Alright, so childhood case of measles. The information on this slide was taken from a Center for Disease Control study, which was completed in 2010 and published in 2011. And the study was done, basically took information over the course of about 70 years. So from the pre-vaccination era in the U.S. until when the study was complete in 2010. And it took the information on the annual infection rates in the United States of a number of diseases. Alright, and so you can see here on the slide, pre-vaccination era, the annual U.S. infection rate for measles was 530,217 annual cases in the U.S. Alright, when the study was completed in 2010, that annual U.S. infection rate was only 61. Alright, so that's already showing you vaccinations work. This next slide, again, the information taken from the same study, and this is a child infected with pertussis, or whooping cough. Right? And the pre-vaccination era infection rate, 200,752 annual cases. In 2010, that number was just down to 21,000 annual cases. A huge, huge improvement. All right, so over the course of this next several minutes of this presentation, I'm going to talk to you about the pre-vaccination era infection rates versus the now 2010 the present vaccination rates and how important vaccinations are to those numbers. I'm going to talk to you about a couple of recent resurgences or new outbreaks of some of these diseases that were previously thought eradicated, specifically in the U.S. And I'm going to talk about why those outbreaks or recent resurgences have occurred because of fears and basically media hype based on false reporting. Okay? So this first graphic that I'm showing you, it's the information from that same Center for Disease Control study. Right? And this graphic was done by Leon Ferrand for Forbes magazine, an online edition. And it just takes all that information that the Center for Disease Control put out and just put it into this nice, easy graphical representation. And what I really want you guys to focus on is the numbers in the middle. Right, this is the percent decrease between pre-vaccination era versus when the study was completed in 2010. I mean, even the lowest number here, pneumococcal disease, pneumonia, 74% decrease. All right, and you can see like polio 100%, smallpox 100%, measles 99, mumps 99, rubella 99. All of this scientific data, all of these studies show that vaccinations truly do work. Right? And so you see the vaccinations work, and so now I want to talk about a recent case or recent outbreak. You might probably heard about it just last month in Disneyland, which was about 50, I think it was 57 cases that happened specifically in Disneyland. And then once California actually compiled all the data and then released their official report, it was 133 cases. So we just saw that 61 cases annual in 2010, and now out of one state, already 200% increase, right? And so we ask ourselves why. And so there were some studies done on this, and I'm going to show you a quote here from this Maimuna Majumdar, who was a research fellow at Boston Children's Hospital, published a letter in the Journal of American Medical Association, Pediatrics, just earlier this year. It says in nice bold letters, the preliminary analysis indicates that substandard vaccination compliance is likely to blame for the 2015 measles outbreak. All right? And that's just one quote, one study out of a number of studies, all right, that have been done because of these recent outbreaks. Another disease that's gotten a lot of coverage in the media recently has been Ebola. Right, and so I just want to shoot up a quick comparison between measles, something that was thought eradicated in the U.S., and something that's been in the media a lot lately, Ebola. So 2, which is the number of hours the measles virus can live, either in the air or on a surface. It's much more transmissible than Ebola, right? And measles doesn't really get much publicity because we've been vaccinating our children and ourselves to get it for so long that that hasn't been an issue recently, right? Just up until the last couple of years when these fears started based on a research study that I'll talk to you about in a minute, all right? And so people started not vaccinating their children and not vaccinating themselves, and now we're starting to see the repercussions or the consequences of not vaccinating your children or not vaccinating yourselves. Right, and so this quote was taken from an article in the Huffington Post online by Anna Almendrala, 13 numbers that explain the resurgence of measles in the U.S. Right. So again, all this data we keep seeing. So, big long quote up on the slide there. Right. So in 1998, a British physician, Dr. Andrew Wakefield, released a study that said immunizations, and specifically several of the preservatives within immunizations, were causing autism in children. Right? And so that sparked a lot of media sensation, a lot of media hype, and a lot of fears in parents worldwide that we're now again seeing the repercussions of. All right? And so I'm going to pull just a couple of pieces out of this nice long quote. All right, it says this specific study, or basically refute for the study, was done by this Dennis K. Flaherty, a PhD at the University of Charleston in Charleston, West Virginia. So, the speculative vaccination autism connection decreased parental confidence, created a health crisis in England, questions about vaccine safety in North America. All right, so a lot of media hype based on one report causes a lot of problems. This Dr. Wakefield was found guilty of ethical, medical, and scientific misconduct, and the alleged autism vaccine connection is perhaps the most damaging medical hoax of the last 100 years. All right, so very, very, very damaging report, and very damaging to basically our public health. Right? So, we talk about, when I also talked about what one of the issues wasn't not just the immunizations themselves, but specifically a couple of the preservatives used. All right, and one of them I'll show you here is called thimerosal. All right, and a number of studies were done about it, again refuting the claims by Dr. Wakefield. All right, and this is another quote from Pediatrics, which is an electronic publication. In 2010, another study was going on while the Center for Disease Control were compiling their results. All right, and this study found no difference in exposure to that preservative thimerosal in children that did not have autism versus children that did. All right, so these preservatives and immunizations and the immunizations themselves were not causing the autism. All right. So, over the course of the last several minutes, I talked to you about the efficacy or how well the vaccinations work. All right, we saw the numbers there, black and white. And I talked to you about that recent resurgences of specifically measles. There's several other cases, and I just don't have time to talk to you about all of them today. All right, but you see that vaccinations do work. I also talked to you about the fears and why all of this fear in vaccinating children started based on one report by a physician. One report sparked all of this. All right, and now we're starting again to see those consequences today. So please, as either future parents or parents yourselves now, please take the time to educate your children. All right, get them vaccinated. All right, because otherwise we're going to continue to see the repercussions of these events. All right, and you definitely do not want these to be your children here. All right, so thank you very much for your time.